nclex or you've written nclex in the past and did not scale through, I want you to know that the nclex exam strategy has changed. It has changed. I cannot say that enough. Hello, Betty. If you can hear me, give me a thumbs up. So we are looking at the strategies and how we can beat the new nclex exam. Thanks, Betty. Thank you so much. So today I will be discussing the top NGN question types and how you can beat them. Thanks, Betty. Thank you so much. So how you can beat them. I have already pinned the focus for today. It's going to be the bow tie, the SATA, and the case studies. And if you're joining us for the first time, you're welcome. Share the live. Invite any students or any nurse that have written nclex before and did not make it, or someone you know that is preparing to write the nclex exam. My international nurses, you are highly welcome. This live is mostly for you guys because most of you are in locations where you have a hard time getting resources for your review. So that is why I am taking the time to review this question strategies. Okay, let's jump into it. Most people are not failing the NGN because they don't study. I want you to understand one thing, that when you have gone through nursing school, the program is rigorous and tough. It is challenging. And it is most difficult for some of us that are going to school as mothers, as fathers. We have other responsibilities. The challenge becomes more. So it is very important that you understand how to answer questions. Some people say examination is not the true test of knowledge. That is true. But the caveat there is, if you do not know how to present your idea to the test of your examiner, you won't be able to satisfy their demands. So people are failing because they don't know how the exam is asking them to think. Did you see that? The exam wants you to think in a different way, not just the way you study in the classroom. The exam is testing something different. So you have to prepare yourself in a way that you will present your answers just as the exam is expecting. So you have to think differently. That way, you will be able to give the exam what they are looking for. Okay? All right, let's keep going. Today, I'm going to show you exactly how NGN questions are built and how to stop losing points, even when you're you kind of know the answer, or, you're not very sure, you're just guessing. So if you are guessing, it's still okay. But the good thing that NGN has done now is, in those guessing moments, especially in the SATA type of questions, when you have to select all that apply, that is the SATA. If you are answering those kind of questions, sometimes that question will have 4 to 5 answers for you to select from the lump sum. If you did not get all 4 correct, you still get some points for getting some of them correct. That is the good thing about it. So now we're going to help you. I'm going to help you know how to pick those points so that you will not be losing your points. Okay? So we will start with the bow tie questions. The bow tie is the biggest one they use. Let me explain it in a very simple way. Bow tie questions are not testing your memory. I have said it severally. You do not have to cram your answers. That is not what bow tie is checking. Bow tie questions are not testing your memory. They are testing your ability to connect a disease to action and safety checks. I'll repeat. The bow tie questions are testing your ability to connect a disease to actions and safety checks. So if you have to do a mental drawing now, on the left, you have something like a condition. In the middle, you have actions. And on the right, you have parameters. That is what the bow tie is. So if you look at it, you see that it has the left, it has the middle, it has the right. So your ability to connect a disease to actions and safety checks. That your safety checks now refer to what you monitor, the things you monitor. Hello, Crystal Lois. You're welcome. Give me a thumbs up if you can hear me. So that is why it is called the bow tie. 3 things are connected. So when you have a bow tie questions, it is testing your ability to connect a condition to an action and to a safety check or parameters or things to monitor. I'm going to give you a scenario to demonstrate this. So let's do this one together. A patient comes in with a sudden shortness of breath, chest pain, oxygen saturation at 86. Now the question is, what is the most likely condition? If you have an idea, put it in the charts. What do you think is the problem? A patient comes in with sudden shortness of breath, chest pain, and oxygen saturation at 86%. What do you think is going on? When you look at this scenario, you will see there is no anxiety. There is no fatigue. So you can suspect something like a PE, pulmonary embolism, chest pain that is sudden, and oxygen desaturation. Those are cardinal points for a pulmonary embolism. Okay? Those are cardinal points for pulmonary embolism. So that is the condition now. Now, action. What do you do first? This patient's oxygen is at 86%. They have chest pain and they are short of breath. What do you do? What will be your first action? What will be your first action? I'm going to give you some options. Give oxygen, start IV fluid, put patient flat, call family. What will you do? What will you do? So, NGN, put oxygen. Beautiful. You got it. You got it, Betty. Thumbs up for you. you give oxygen. So NGN always rewards you for safety. So the first thing you do is what? You give oxygen. When you give oxygen, then you can elevate the head of the bed. You don't put a patient that is struggling to breathe flat. That's a no-no. Hi, Amy. You don't put a patient that is struggling to breathe flat. So you can see how we connected a condition to action. That is the first part of it. Then the last part of it now is the parameters. That is the right side. We've done the left side, which is the condition. We've done the middle side, which is the action. Your action is to give oxygen and possibly elevate the head of the bed and not put the patient flat. Then the third part is the parameter, which is the right side. What will you monitor? I told you the bow type has to do with your ability to connect a condition to an action and a safety check or a parameter. So you have recognized a problem, a condition, you have intervened by giving oxygen. Then, how do you know if your action has helped the patient? That is your parameter. That is your safety check. So what will you monitor? You will monitor oxygen saturation. What else would you monitor? What else do you think you can monitor at this point? If you have any idea what you can monitor, you can put it in the charts. So we've said we will monitor oxygen saturation. The previous oxygen saturation was 86%. So now that we have given oxygen, what would tell us that what we have done is helping the patient? We will monitor the oxygen saturation to make sure it has come up. What else are we going to monitor? We'll monitor respiratory status. Okay, we'll monitor respiratory status and we'll monitor heart rate. So these are the things you can monitor when you put somebody on oxygen. You want to make sure that they are saturating. You want to make sure that they are not tachypneic and they are not tachycardic. Of which these are the three things that happen when somebody has a PE. So you want to see improvements in this area. And when somebody is struggling to breathe, automatically they breathe faster and their heart rate goes up. So when you supplement oxygen, you should see an improvement in these three areas. So this is how the bow type works. Okay. If you monitor blood pressure only, you will miss respiratory collapse. So remember that the focus now is on the respiratory status. I'm not saying you will not monitor the other things, but for this particular question, because if you go to my page, I post questions that are provocative to make people comment. Some people leave what the answer is and they will be saying something else. We know all these things, but we want you to answer only what you are asked. Okay? So answer only what you are asked. You don't need to explain it. You don't need to give us rationale, except you are asked to give rationale. So stick to answering what the question have asked you. That will save you time and that will make things easier for you. Okay? So if you miss the condition, everything else will become wrong. So if you are not able to recognize the condition, you are going to miss the action and you are going to miss the safety check. So that is why it is very important for you to be able to analyze the condition, be able to intervene based on what you have analyzed, and then do your safety check. So this is your bow tie. Bow tie is big on NGN. You can't afford to miss any of it. Okay? In as much as you might get partial credit for getting any part of it correct, your chances of losing the entire point is very high if you did not recognize the original condition, the correct condition. If you did not recognize the correct condition, you are going to miss the rest of it. Okay, so that is the bow tie question style. If you have any question on the bow tie question style, put it in the comments and I will read it and give you an answer. All right. So I'll keep going. If you have any concerns, put it in the chat and I will respond. The second part that I want to discuss here is the one moment. The second part I want to discuss is the SATA, the SATA style. That is, select all that apply. So some people will hear me say SATA, SATA, SATA. Some of them don't understand what I mean by SATA. So SATA means all, select all that apply. So whenever you see a SATA question, it might have, it is requesting you to pick all that apply. Okay, it is requesting you to pick all that apply. So you will have to select all that apply. Where I'm focusing. All right, so I have discussed the bow tie. So right now I am on number 2, which is the SATA. And like I said, the SATA type of question gives you partial credit if you did not select all that apply, if you are able to get part of it. Okay, so SATA is not testing how many facts you know. It is testing whether you can identify safe nursing actions. That is what happens. SATA is not testing how many facts you know. It is testing whether you can identify safe nursing actions. So the important thing you want to know about SATA is, stop asking, does this sound correct? That is not what SATA tests. Stop asking, is this safe? What you have to start asking is it safe? Is the priority right? Okay, so you have to ensure that the options you want to select are safe and they are of priority at that time. So I'm going to give you a live example. A patient with diabetes is having hypoglycemia. I will give you the options and I would want you to participate because your active participation tells me that you are understanding what I'm saying. So for our SATA type of question, the scenario is a patient with diabetes is having hypoglycemia. Options: give orange juice, administer insulin, recheck blood glucose, give IV dextrose, encourage exercise. I'm going to put it in the out. I'm going to paste them in pieces because sometimes TikTok will not let you put a lot of stuff in the comment. All right, so I'm going to put. Okay. All right. So you can see the questions. A patient with diabetes is having hypoglycemia. And the options that follow this question is give orange juice, administer insulin, recheck blood sugar, give IV dextrose, encourage exercise. So for this patient, what is safe? What is safe for this patient? If you know the safe thing to do for this patient, put it in the comments. You have all the options there. What is safe for this patient? Patient is having hypoglycemia. That is low blood sugar. What is the safe thing to do for this patient? If you're having a hard time answering a SATA question, the first thing you can do is use the elimination method. The elimination method helps you narrow down. So what you do is if you see something that you are certain that you cannot do for this patient, strike it off. Then that way you narrow yourself down. So what do you do for this patient? Put it in the comments. I'm going to give a minute for anybody that have ideas of what we can do for this patient to lead the discussion. Okay. All right. I'll walk you through it. First of all, the patient is hypoglycemic. So automatically, we cannot give this patient insulin. That one is out. From the 5 points, we strike that one out. We cannot give insulin because insulin is going to make the condition worse. Now, Betty, look at the options. Look at the question and the options. The person with hypoglycemia does not have a breathing problem. They don't have a breathing problem. Okay, so you talked about orange juice. What if this patient is not conscious? What do you do? Orange juice is correct. If this patient is conscious, you give orange juice. No, you're fine. You're fine, Betty. No, sorry. Okay, so give orange juice. Correct. If the patient is conscious, always remember that sometimes hypoglycemia can progress very quickly and the patient is not safe to give anything by mouth. So what else do we do? What else do? We give them orange juice. We say we cannot give insulin. The reason is because insulin will worsen the situation, so we cannot give insulin. What else can we do? We give IV dextrose. Yes, IV dextrose if they are unconscious, right? That is, if this situation is getting severe or they are becoming drowsy, we give IV dextrose. And lastly, we recheck the glucose. We always have to evaluate. We always have to do our safety check. So you give orange juice if they are conscious. You give IV dextrose. If it is severe and they are drowsy and they are not safe to take anything by mouth, and you recheck the glucose. Correct. So, like I said, the NGN SATA is not about choosing everything you recognize. It's about avoiding what will harm the patient. Like I said, use the elimination method. The elimination method helps you get rid of things you know that they are a hard no. You cannot do that. If somebody is having hypoglycemia, there's no way you are giving them insulin. There's no way they are going to exercise. They don't even have enough glucose in their system. Are you going to make them exercise? That is a no-no. So by the time you eliminate those two, every other option that is left is beneficial to this patient in this condition. Any questions? Excuse me. Any questions? Concerns? All right. In the absence of questions, we will proceed to the third part of the NGN style of question, which is the case studies. So I've been getting a lot of questions about case studies, and I'm not just gonna do it this one time. Any other time I come live, I'm going to discuss case studies. So the case studies are when the NGN become real life. I told you that the NGN tests your clinical judgment all the time. And these are the different ways they test your clinical judgment. So the case studies are like real life problems. Now you are in charge. You have to make a decision. So case studies are where NGN becomes real life situations. You don't get one question. You get a changing patient story. Just like you took care of it, you came to work in the morning, got report on a patient. Patient was okay, walkie-talkie, doing okay. And by midday, the condition changes. Patient started throwing up. Patient started having headache, abdominal pain, blood pressure went up. So it's just gonna be a roller coaster of patient changing situation. That is what you see in case study. You started from one thing, you are going to progress into 3, 4, 5 different things. From just one case study, you can have 5 to 7 questions on just one case study. So you have to pay attention whenever you have a case study, because where you started is not where you are going to end. It's going to take you to some other place. Okay? Please share the live, invite people, invite anybody you know that is preparing for NCLEX or somebody that have written NCLEX before. They should join the live so that they will understand the strategies and what NGN is currently doing. Okay? All right. I'm going to give you a live case. The first phase of this problem. Patient admitted after surgery, had mild pain with a stable vital signs. Patient admitted after surgery. So you came to work, got report, and all of a sudden you had an admission. And that admission that you had was a patient that underwent surgery. They had mild pain and their vital signs are stable. Let me ask you a question. Is this normal? Answer me yes or no in the chat. When you receive a post-op patient, they have mild pain, they have stable vitals. Is it normal? Are you concerned or worried about anything? Betty said yes. So this is considered a normal post-op. No problems. Everything is good. All right. So we went forward. It is expected, correct? So patient had a surgery. They obviously have slight pain, but their vitals are normal. Everything is good. Good to go. We settle our patients. Then we move to the second stage. Later, heart rate increases to 120. Blood pressure drops. Patients became restless. Now the question comes, what's changed? What's changed? In your opinion, what's changed? What do you think happened? How do you explain what is going on? Heart rate increases to 120, blood pressure drops, patient is now restless. Would you consider this normal? Do you think something is going on? What will you do? Maybe, or maybe not. He didn't say anything about shortness of breath, which you know that in PE, we have shortness of breath is a must. So it could not be a PE. So what do you think it is? The patient is not complaining of pain. There's no pain. And you know in PE, the patient has pain. Hemorrhaging. Possible internal bleeding. Yes. Patient might be bleeding. So, which you know is very common in most post-op. They might just start bleeding. We don't know why. Question 3. What is your first action? I'll give you options. Now you are sure that something is not right. You have recognized that the patient's condition has changed. You have made a tentative diagnosis in your mind that patient might be bleeding because of the low blood pressure, correct? Patient might be bleeding. Patient is restless. Heart rate is going up. So what is going on? The heart is compensating in order to pump more blood to the vital organs. So it's a possible internal bleeding. So what is the first thing you do? I'll give you options. Give pain medication. Check the incision site. Call the family. Encourage ambulation. So if you are paying attention, you will see how this patient's condition is evolving and changing. So the options I gave is now we diagnosed hemorrhage, internal hemorrhage. And I told you that patient did not report any pain. So to the options, give pain medication. Patient did not report any pain. So why do we want to give pain medication? That is out of the way. Option 2, check incision sites. Option 3, call family. Option 4, encourage ambulation. I don't know if you want to encourage ambulation in a patient you suspected that they are bleeding. What do? What do you think you can do? What should be the first thing you should do when you suspect that your post-op patient might be having an internal bleeding? What do? Check the incision site. Perfect. You check the incision site. At least that will tell you. If it's bleeding, you will see that the dressing is getting saturated or there might be active bleeding just coming from there. So you check the incision site. And when you check the incision site, what do? You notify the provider immediately. Calling the family is not a priority at this time. So the only correct thing you do is assess the incision time. Based on your findings, you notify the provider. Okay. So NGN case studies reward pattern recognition. So if you see what we are doing, the way we are answering the questions, we are recognizing the pattern. We are not just guessing. We are being realistic, because if you are in the clinic or in the hospital or in your unit and you have this patient, this is exactly what you are going to do. Like I told you, this is bringing your cases in the hospital to life. The case studies are bringing those cases to life. Those things you do every day in the hospital, those things they are being taught every day in your sim lab, that is what the case studies are all about. So you just don't want to miss it. You can't mess it up. Okay, so this is how you answer the case study questions. You recognize a pattern and you continue to follow that pattern, be using your clinical judgment without guessing. Okay, so what is the most difficult thing if you are preparing for exams, or if you wrote the exams previously and you did not get through? What do you think that was the issue? Have you been able to review? Because when you write the exams and you did not scale through the first time, you get the reports of your performance and areas you're supposed to work on. What do you think? What went wrong? What was the difficult thing? Have you come across questions like this? Are you surprised? Hello, Sharifa. Thanks for joining. Are you surprised? Okay. Are you able to recognize stable and unstable patients? Just like our post-op patients. So when we have post-op patients, there are things we expect them to have. They should have some pain. Okay, so if a post-op patient comes in and is screaming, or maybe during your assessment you notice like some tenderness, say they had like an abdominal surgery, there was no bowel sound, these are normal findings. They are not things that should startle you, because they are normal findings. You should be able to differentiate normal findings from abnormal findings, and you should be able to recognize changes, especially from your stable patient, when your stable patient becomes unstable. Just like in the case study, we saw how a post-op patient that we received that was stable, vitals were stable, mild pain, evolved from stable to unstable with signs of internal bleeding. Okay. Are you able to recognize your first action? Always remember the ABC. The ABC of every management in nursing. You apply it. If a patient comes in with shortness of breath, no matter what the situation is, throw in 2 liters of oxygen on them and then continue with the other things. And one thing you have to know is that your actions are not wrong, but most times what you start first is what makes your answers wrong. Because they will always ask you, what will you do first? Prioritizing. What do you do first? So if you're not able to prioritize correctly, you are going to miss it. It doesn't mean that the other actions are not correct. They are correct, but they don't come first. They don't come first. So you have to use your clinical judgment to know what should come first, and then what will come subsequently. All right. So if you have any question or anything that you're confused about, or something you have seen in your past exam, or areas that doesn't seem very clear, put it in the comments. That will help me know the areas that I can touch to assist you in your journey of writing your exams. Okay. So I'm going to recap In the absence of question, if you have anything to write, just go ahead and write in the comments. So I'm going to recap again. We focused on 3 exam styles of the NGN. The bow ties, the SATA, which is the select all that apply, and the case studies. So I told you that the bow tie tests connections. Connections, that is what the bow tie tests. Condition, action, and evaluation, that is your outcome or your parameter. The SATA tests safety. It tests safety. And the case study tests thinking over time. Okay, so if you master these things, these strategies, if you understand what NGN is looking for, then you are as well as good as have passed your exams. So, and the biggest takeaway from this live today is that these 3 areas that I discussed are the areas most test takers fail all the time, because it has a lot of connections. It has a lot of branches. It's not a standalone question. All 3 questions that we discussed are branched, connected somehow. If you go to my page, you will see some case studies that have like 7 questions under them, 5 questions under them. Okay, so all you need is constant practice. When you practice consistently, you understand and you'll be able to make those connections, those clinical connections. Use your critical thinking power to make those clinical connections. Okay? So again, like I said, the NGN is not testing how much you know. That's not what it does. It does not test how much you know. It is testing whether you think like a nurse, especially under pressure, because the way we are discussing these things is not how it is going to present yourself. It's going to be fast. It's going to be swift. It's going to need immediate intervention. Okay? It's going to be fast. It's going to be swift. It's going to need immediate intervention. Okay? Betty, if you click on the plus sign, you'll be able to follow me from there. Okay? So that if I drop a video, you'll see it. I drop questions almost on a daily basis, and I try to go live. Sometimes not every day, but I try to go live as much as I can. All right. So do not, sometimes when we are studying, we feel like, I don't remember what I'm reading. Oh, I've read all these things. I don't remember anyone. It's normal. So when you study, it just gets into your brain, in your short-term memory, and like it's gone the next moment. But consistency is what internalizes it and exits in your long-term memory. Okay, so when we post these questions, we are not posting them for the sake of you looking at it. Just thank you, Betty. Thank you so much. So when I post these questions, the goal and the aim of posting these questions is for you to quiz yourself. Don't be quick to go and look at the answers. I definitely drop the answers, but when I put the questions, I want to know what you know. I want to know if you remember what you should do. There was a question I posted about pushing IV potassium. Oh, the reaction has been massive. But the question I have there is that somebody actually asked me what will happen if she knew you cannot give it, but she doesn't know what happens to the patient when you push potassium. She doesn't know what happens. when you push potassium. So I said, yeah, knowing that you cannot push potassium is one thing, but knowing what happens to the patient when you push potassium is another thing. So sometimes I post some of these questions. I said, why? Why shouldn't you do it? Because the reason why you should know that is when you have a patient that has a potassium of 7, that will put you on a high alert, because you will know that this person might go into a cardiac arrest at any time. And you should be intervening like this. So when you push potassium, it triggers those abdominal arrhythmias that can actually cause a cardiac arrest. So that is why when we have patients, for example, patients with renal failure or other kinds of cardiac situations, renal situations, they come in and their potassium is 6 points, 7 points, and their kidneys are bad. We either treat with insulin potassium, especially the renal patients, because some of them, they just can't get rid of those waste products. It just keeps accumulating there. So when you hear that, oh, a patient is getting dialysis because their potassium is 8, don't be surprised. They might not be dialysis patient, but that is the only way to get rid of it at that time, because there are some people that when you give them you gave them D50 and insulin, it did not help. And by the way, who knows what insulin does what does insulin do to potassium? What does insulin do when you give insulin and hyperkalemia? What does insulin do? And why do we give D50? If you know, put it in the comments. If you know, put it in the comments. What does the insulin do? What does it do to the potassium? What is the mechanism for reducing the excess potassium in the blood? And why do we give a D50? If you know any of these answers, put it in the chat. We are learning. We are learning. We are all learners. So put whatever information you know, and let's see what others say. Let's see what others say. Well, if nobody knows, that will be your assignment today. Find out. Find out. Hello, user 54955437841. Thanks for joining us. We're almost wrapping up, but thanks for joining anyway. Okay, so this is how NGN tests you. Okay, it is not about how much you know. It is not about reading all the books. You need to understand the strategy for writing the exam. You need to think like a nurse. You need to be able to think under pressure. Okay? So that is what NGN does. NGN wants you to think like them. So if you are not thinking according to what NGN is testing, scaling the exam will be a challenge. So as you are reading, you have to practice. Practice, practice, practice. So if you go to my page, you will see so many questions, different kinds of questions. Yesterday, I posted PEDS because somebody actually messaged me to say that her last exam was full of Pete's question and that she did not know how to go about it. So I posted a lot of Pete's, and there has been a lot going on since that time that I posted it. So many people have been watching, commenting. So if you head over to my page, once I'm done, you will see a lot of review questions. You will see a lot of practice questions. Go through them. Anything you do not understand, send me a message. Or if there is any area you want me to treat, I can treat anything live. Priority questions, med surg, critical care, psych. Just let me know areas you want me to treat and I will discuss them. I will always post when I go live. Sometimes I post like 30 minutes before the time, so that that is why you have to follow, because that's the only way you get the notification to know that I'm going to go live. Okay. In the absence of questions, I think we'll stop here until the next time. Good luck with your studies, and continue to stay safe there. Goodbye, everyone. I will post the live. I will post it. I'll put it up on my page. I'll put it on my page. So since you have followed, you will see it on my page when I'll go live, okay? God bless you too. Thanks for joining, Betty. Okay. Bye, everyone.